topic that probably all of us have experienced by now, and it's also one of the most common causes of people not being able to attend work. So I'm going to talk about back pain, and I'm going to focus on acute back pain. So the most common cause for acute back pain is when there's disruption of the normal structures in the back. So in the back, we've got the vertebra, the bones, we've got ligaments, we've got muscles. So when there's disruption of those structures, then we can have acute back pain. Examples would be strain on the back, so overstretching of a ligament because of certain movement or an injury, and then also spasm because of twisting too fast or lifting an object improperly. So those are the most common causes for acute back pain that we see. So what are the things that make you prone to developing acute back pain? So age from 30 and upwards, we see back pain in those age groups most commonly. We do see it in school children as well, with overloading of backpacks and all of that. And then also in people that are unfit. So if you have a weak abdomen and weak back muscles, that also makes you more prone to developing back pain. Weight gain is a big risk factor, especially when you gain weight suddenly for some reason and now your body is carrying a heavier load. So that's one of the causes of back pain. And then job related factors. A lot of people have to lift heavy objects for a living at work, and that can give them a lot of back pain, especially if they don't lift the objects properly and they're not taught to do that at work. Smoking is a cause of back pain, more chronic back pain, because it prevents blood flow to the discs in between the vertebra, and then it causes faster degeneration. So that falls more under chronic back pain, but it is something that puts you at risk of having back pain. Just to keep that in mind. And then poor posture. Poor posture is very important. Mental health, stress and depression can also lead to increased muscle tension that can then give you back pain. So most of the time the diagnosis is quite straightforward. There's always something to identify what happened to give the person back pain. Most of the time it's people lifting heavy objects or twisting too fast or something, and then it's quite easy to treat it. You don't ever really need x-rays unless we are worried about something more serious. Same with MRIs. The MRIs are more for the acute severe back pains where there's neurological symptoms, for example, loss of bladder function or loss of function in the legs, those types of things. So don't be too worried when you have back pain that just started a couple of days ago and you've been aware of it. You're probably just having an episode of acute back pain and you don't need too many investigations. If you are concerned though, it would be wise to see your doctor. So how do we treat these back pains? So we treat it with normal Panado and anti-inflammatory medications. There's nice combinations like the Mypains and the Gempains where you have a combination of the two, and those are the medications commonly used to treat back pain. We do sometimes prescribe muscle relaxants as well. Those you can't get over the counter, that your doctor has to prescribe for you. Normally for 5 days I prescribe it just to help if there's spasm in the back, to relax it. There's also gels that you can use, Voltaren gels, there's Transact patches, there's heat packs, heat and ice packs help to relieve the inflammation and reduce the spasm, and that alleviates the back pain quite nicely. And then gentle stretching is important to do when you're experiencing back pain. So when you are having an episode of acute back pain, which is less than 2 weeks, then bed rest is not really advised. You can manage the back pain by treating it with medications, gentle stretches, muscle relaxants, heat packs, gel packs, whatever works for you. Only if the back pain persists after that, then you can discuss with your doctor what the further management would be and if it needs to be investigated any further. So that is basically how we treat back pain in the acute setting. So you can do that at home as well. You don't even need to see your doctor. So what can we do to prevent back pain? So exercising is important so that we have strong abdominal and back muscles. Will prevent us from having too much back pain. Maintain a healthy weight. That's very important. For people at work, make sure that your desk chair is ergonomically friendly. A lot of big companies have companies that come in specifically to give them ergonomically friendly chairs for their workers, because they know back pain is so common, and obviously if you have back pain then you won't be able to go to work. So a lot of companies actually make sure that their employees have proper chairs and special chairs for ones with specific sorts of back pain because of specific diseases. So make sure that your chair is friendly. And then make sure that you switch sitting positions while at work. Don't sit in the same position the whole time. Try and get up, stretch every now and then, take a walk to just give your back a break, that you're not in the same position the whole time. And then make sure that you wear comfortable shoes. I'm sure there are a lot of women who can say that after you wear heels to work, your back is going to pain, but then you know where that's coming from. So it's always good to bear in mind things that you do, and you can sort of figure out where you got yourself injured. So wear comfortable shoes. Practice proper lifting of objects. That is extremely important. I think most of my patients who complain of back pain will report lifting something heavy, and if I ask them how they lifted it, then they didn't lift it properly. So I'm actually going to post a video just now of how to do proper lifting. And then quit smoking. Quit smoking, it's always a big thing for everything. Just quit smoking. And then make sure that you take in enough calcium for to maintain the bone integrity. So yeah, that's basically back pain in a nutshell. Very short vlog today. Let me know if you have any questions. Please share the blog with your friends and your family. Please invite people to like my page, and thank you for listening.